Hello. We are from Group 3B1. Today, we are going to present about our case study on cervical cancer stage 3B. So, this is our outline for the presentation. First of all, we choose cervical cancer for our case presentation because it is the third most common cancer among Malaysian women. It is known as a silent killer worldwide. The main cause for the cervical cancer is human papillomavirus or HPV.
This is the outline for case presentation. On October 16, 2017, there was a patient admitted to female RTU ward at 12:45 p.m. Her name is Madam K, who is 40 years old. She is an Ibanese, who live in Tata, Sarawak. Madam K is married and only has one child. She used to work as a cleaner but currently unemployed since 3 years ago. She has been diagnosed with cervical cancer stage 3B. She comes to Sarawak General Hospital for her cancer treatments, which are chemotherapy and radiotherapy. She is referred from Hospital Bintulu. She complained of prolonged menses for a few months. As for the presenting symptoms based on Socrates, firstly, the site of bleeding is vagina. The onset of prolonged vaginal bleeding is on February 2017. She described bleeding as fresh blood. There is no radiation or associated signs and symptoms that related with the prolonged menses. The menses are continuous with minimal to heavy bleeding. Patient's past health history. First of all, patient does not have any medical or surgical history. There is no medication or allergies. The last hospital admission is on August 2017 at Hospital Bintulu. The reason for her admission was to rule out about the cervical cancer and getting the treatments. As for the family history, she has 7 siblings, and no malignancy history in the family. She is a non-smoker and used to drink alcohol but stopped years ago. She claimed that she does not have any appetite to eat, and decreased in body weight, which is from 60 kilograms to 43 kilograms. She also stated that she does not have enough sleep and rest. She claimed that she is worried about the treatment of the cancer. Her main supporters are husband and son. She does not take any contraceptive pills. There is no history of pap smear test. Her menarche was at the age of 13 years old. Her menstrual cycles are regular, but start to have prolonged menses on February 2017. She unable to undergo for PIPEL and pap smear tests during appointment due to menses. After that, she did not go to the hospital for the next follow-up. On August 2017, her menses became heavier and she went back to the hospital. Lastly, she is admitted to the hospital on the August 8, 2017 to rule out about the cervical cancer. Patient's condition during the assessment. She is conscious, alert and well hydrated. She is able to orientate to time and place. Her height is 153 centimeters and weight of 43 kilograms. She got full marks for Glasgow Coma Scale. The vital signs are BP 100/70 mmHg, pulse rate of 108 beats per minute, breathing rate of 20 breaths per minute, SpO2 of 97%, and no fever. She denied any pain.
As for respiratory, cardiovascular and metabolic integumentary systems, the findings are all normal. For abdomen, it is soft and no tenderness found. But there is a mass found at 12 o'clock at the pelvic region. As for the sensory and musculoskeletal, there is no abnormality.
Next, the table shows patient's clinical examination results during the admission in Hospital Bintulu. The first one is transabdominal scan. From the scan, there was cervical mass seen. Secondly, they test for HPE. The results were full thickness moderate to severe dysplasia. Thirdly, patient went to EUA, cystoscopy and cervical biopsy. The findings was patient has huge cervical mass and the tumor is mainly endophytic. She also went for LLETZ biopsy for HPE. They found out that there was cervical carcinoma with moderately differentiated invasive squamous cell carcinoma. Lastly, CT scan is performed. From the CT scan, patient has cervical mass with local infiltration to the uterus and vagina, with left obstructive uropathy. There was also no evidence of distant metastases. From the 5 examinations, they concluded that patient has cervical cancer stage 3B. Now, after admitted to SGH, patient had several laboratory tests. The tests were urinalysis, blood urea serum electrolyte and creatinine test, and 24 hours urine creatinine. All test results were normal findings which indicate a good kidneys function. The full blood count test also been done. At first, there were some abnormal findings noted. After 1 pint of packed cell transfusion on 18th of October 2017, the test is repeated for the next day. However, the results still abnormal, but it shows some improvement.
This is the outline for disease process. Most of these risk factors are associated with the infection with human papillomavirus, in relation to increased risk of having, or acquiring compromised immune response. These include early onset of sexual activity. As mentioned by Frumovitz, the risk is approximately 1.5-fold for 18 to 20 years, and 2-fold for younger than 18 years compared with age at first intercourse of 21 years or older. Increasing number of 3 or more full-term births and early age at first birth, which is younger than 20 years old, are also associated with an increased risk of cervical cancer, which are likely due to exposure to HPV through sexual intercourse. a partner with multiple sexual partners, or known human papillomavirus infection and use of oral contraceptive, have also been reported to be in close relation with an increased risk of cervical cancer. As stated by Gomez-Santos, human papillomavirus plays a great role in the development of cervical neoplasia. It can be found in 99.7% of cervical cancers. Skin-to-skin contact is known to be the primary mode of transmission of HPV. Basal cells of stratified squamous epithelium may be infected by HPV, while other cells types appear to be relatively unaffected. Entry of the virus into the cells of the basal layer of the epithelium marks the beginning of HPV replication cycle, in which it requires mild abrasion or microtrauma of the epidermis for HPV infection to occur. Once inside the host cell, human papillomavirus DNA replication progress to the outer part of the epithelium. Viral replication is considered to be non-productive in the basal layer. Therefore, the virus uses the host DNA replication machinery in order to establish itself as a low copy number episim to synthesize its DNA on average once per cell cycle. Cervical cancer is among the best understood examples of how viral infection can lead to malignancy. In high-grade intraepithelial neoplasias and invasive cancers, HPV DNA generally is integrated into the host genome, unlike in benign lesions caused by HPV, whereby the viral DNA is located extrachromosomally in the nucleus. Integration of HPV DNA results in loss of E2 expression due to deletion of E2 region. This alters the function of E2, which normally suppresses the transcription of the E6 and E7 genes. As a result, there is an increased expression of E6 and E7 genes. During a productive HPV infection, the normal function of E6 and E7 products is to subvert the cell growth regulatory pathways and modify the cellular environment in order to facilitate viral replication. However, in the case of E2 function alteration, the E6 and E7 gene products deregulate the host cell growth cycle by binding and inactivating two tumor suppressor proteins, which is the retinoblastoma gene product and the tumor suppressor protein. The inactivation of tumor suppressor protein and retinoblastoma gene product proteins can lead to genomic instability and an increased proliferation rate. As a consequence, more and more damaged DNA are accumulated in the host cell that cannot be fixed, leading to altered cancerous cells. HPV infection of the cervical epithelium initiates the pathogenesis of cervical cancer during sexual intercourse. However, only a small number progress further into cervical cancer, although a huge number of sexually active young women are exposed to HPV infections. According to Gomez-Santos, several studies have suggested that most women successfully clear the HPV infection, presumably through the action of a competent immune system. Other factors such as frequency of reinfection, genetic predisposition, co-infection with more than one HPV type, intertypic genetic variation within HPV type and hormone levels, may also affect the ability to clear a HPV infection. The natural history of cervical cancer is a continuous disease process that progresses gradually from mild cervical intraepithelial neoplasia to more severe degrees of neoplasia, and finally to invasive cancer. It is plausible that high-risk HPV infection occurs early in life, may persist, and may lead to a gradual progression to more severe disease, in association with other factors promoting cell transformation. Progression to cancer generally takes place over a period of 10 to 20 years. However, some lesions become cancerous more rapidly within 2 years. Management and outcome.
On October 16, 2017, abnormal bleeding is symptoms of cervical cancer. Patient had the risks of abnormal bleeding, thus vaginal discharge were assessed every shift. On October 16, 2017, bleeding was half-pack soaked. On October 17, 2017, patient was planned for radiotherapy 2D, core conflictual relationship theme CCRT, high-dose rate HDR brachytherapy. Overall, the purpose is to treat the cancer tumor effectively. Vaginal discharge was 1 pad-soaked blood. Used creatinine and urinalysis for laboratory investigations. There was no abnormality from the results. FBCDC is screening test to check for such disorders as anemia because patient have the risks and she is bleeding. The results are low red blood cell 2.86, low hemoglobin 8.2, low hematocrit 26.2, low microhematocrit 31.3, high red cell distribution with corpuscular volume and standard deviation 17.2 and 58.0 respectively. This shows that patient is having anemia due to abnormal bleeding. Thus, 1 pint packed cell was ordered for oxygen carrying capacity in short time because of anemia. On October 18, 2017, vaginal bleed was have soaked pad. 1 pint packed cell have been transfused. No abnormality in creatinine and 24 hours urine creatinine clearance test. On October 19, 2017, blood test FBCDC have been repeated to observe effectiveness of blood transfusion. Results are low in red blood cell, hemoglobin and hematocrit. Patient is anemic with high platelets and red blood cell distribution width. Medication is prescribed instead of blood transfusion. On October 20, 2017, patient await for radiotherapy. Vaginal bleeds spotty only. Medication prescribed are tranexamic acid, tramadol, folic acid, vitamin C and ferrous fumarate. Tranexamic acid is used to treat or prevent excessive blood loss. Common side effects are nausea and vomiting, back pain or abdominal pain. Emphasize patient to inform physician if having severe allergic reaction or chest pain when taking tranexamic acid. Tramadol is used to treat moderate to severe pain. Most common effects are dizziness and headache. Make sure to monitor vital signs when patient on this medication. This medication is used to treat megaloblastic anemia due to lack of folic acid. Common side effects are rashes, itchiness and dizziness. Educate patient to eat more vegetables and fruit as it contains folic acid. Vitamin C is important for collagen production, bone, tendon and ligament health, and as a powerful antioxidant. It is also used to treat or prevent malnutrition. Vitamin C does helps to enhance the absorption of iron. If taken vitamin C in high dose, patient may has abdominal cramps or heartburn. Encourage patient to eat more citrus fruits as it's contain lots of vitamin C. Ferrous fumarate is used to treat iron deficiency in anemia. The common side effects are constipation, dark stool and nausea and vomiting. First, monitor patient's blood test result to see its effectiveness during the therapy. Then, monitor bowel movement to detect any constipation. Educate patient to take citrus fruit or vitamin C in enhancing the absorption of iron.
Nursing care plan.
The first nursing diagnosis is risk for hypovolemic shock related to excessive blood loss secondary to continuous vaginal bleeding. Our goal is to maintain her blood pressure reading in normal range and normal blood test result throughout the hospitalization. The first nursing intervention is observe patient's individual response to bleeding such as weakness, as this response can help to identify the severity of the bleeding. Secondly, monitor vital signs especially blood pressure reading and pulse rate because low blood pressure readings and increase in pulse rate indicates excessive blood loss. Third, to have strict pad charting in every shift in order to monitor the volume of blood loss in a day. Fourth is to perform blood investigation as ordered to monitor any abnormal blood count especially for red blood cell and hemoglobin. Then, administer tablet tranexamic acid is prescribed for treating or preventing excessive blood loss. Lastly is to transfuse packed cell if ordered to prevent or treat anemia. Next, imbalanced nutrition less than body requirements related to poor oral intake is evidenced. Patient weight declined suddenly from 60 kilograms to 43 kilograms. The goal is to evaluate that patient's appetite will increase and starts to take adequate amount of oral intake during hospitalization. So, the first action is to review and take note on patient nutrition history from family members, as family members may provide more accurate details on patient eating habits. Next is encouraging the patient to have good oral hygiene before eat as it can help in increasing patient appetite. In addition, encourage her to eat in small amount but frequently to decrease the feeling of fullness. Besides, advise her family members to eat with patient because by having companionship, patient appetite will be more stimulate compared eating alone. Provide clean and comfortable environment for patient during eating in order to create pleasant environment in helping to stimulate patient oral intake. Lastly is do weekly weighing as planned by doctor in order to monitor patient's condition whether deteriorating or getting better during the hospitalization.
Evaluation. Patient's appetite increased and she ate small amount of food but frequently. Lastly, the third nursing diagnosis is anxiety related to disease. As evidenced by patient's gloomy facial expression and verbalized she is worried regarding to the cancer treatment. Our goal is patient will show calm facial expression and her anxiety level will be decreased in 2 days. The nursing intervention are 1. Assess for patient sign and symptom of fear and anxiety to monitor patient behavior. Vital sign and verbalization of the feeling of anxiety. 2. Orientate patient to the ward's environment in order to help patient to get more adapted to the ward setting. Equipment and to allay the anxiety. 3. Advise patient's relatives to always being by her side throughout the hospitalization. As support from the people who are closer to the patient help her to be more calm and safe. 4. Explain to the patient and relatives the matter regarding to the activities and procedures that involve the clients. By using non-medical terms so that patient will be more understand the treatment and to gain cooperation during throughout the treatment. 5. Use treatment touch and healing touch techniques. Because anxiety decrease in therapeutic touch condition and healing touch may be the most useful nursing intervention in helping the patient to feel they are supported emotionally. So, from the interventions we able to help the patient to feel more calm and reduce her anxiety level in 2 days.
As a summary, cervical cancer is one of the top 5 cancer happen among the women.
Many people suffer from the first they are diagnosed, therefore we should be more alert and aware on what we should do to prevent the risk of getting it.
Nurses should be more empathize on them and understand them, especially through their emotion and psychology. That's all from our group. Thank you.